A 2-year-old newborn is brought due to yellowing of his eyes. 2 days later, the jaundice worsens and labs show elevated bilirubin. Phototherapy is started. What best explains the mechanism of action of phototherapy? A. It causes bilirubin to go to the basal ganglia. B. It fixes the underlying decreases in UDP glucuronosyltransferase transferase. C. Creates water-soluble bilirubin from unconjugated bilirubin. D. Creates water-soluble bilirubin from conjugated bilirubin. So I'll let you answer the question, and then I'll explain. Okay, so the answer is going to be C. Creates water-soluble bilirubin from unconjugated bilirubin. So for this one, the problem with bilirubin and why it's important is not just because it worries the parents, because obviously if their child's eyes become yellow, then they're concerned about it. But the primary reason is because bilirubin, which is the breakdown of hemoglobin, is lipophilic, especially unconjugated bilirubin. So since it's lipophilic, it means that it can cross the blood-brain barrier. Now remember, the blood-brain barrier is meant to keep out charged ions, and a lot of stuff cannot pass through it, and it's a way to protect the brain from bacteria and potentially viruses and fungi. And the problem with bilirubin is when it's lipophilic, it can actually cross the blood-brain barrier. Now, this condition is called kernicterus because the bilirubin can go and deposit in a specific part called the basal ganglia, and then that can cause brain damage irreversibly. And the good thing is this jaundice usually resolves in 2 weeks, and phototherapy helps because it actually changes the unconjugated bilirubin to water-soluble bilirubin. Now, once it becomes water-soluble, it becomes charged and can no longer cross the blood-brain barrier and can no longer cause kernicterus. And the second thing is you can excrete it through the urine. And so the other answer choices are going to be the decrease in UDP glucuronosyltransferase. So this is associated with Gilbert syndrome. So this wouldn't pertain to this question. And A is just not a mechanism. Phototherapy doesn't cause bilirubin to go to the basal ganglia. And so for this question, you just had to know the clinical presentation of jaundice in a newborn, which is actually a very common condition, and know the relevant treatment for it, which is going to be phototherapy, and finally know the mechanism of action of that said therapy. So I hope that helped, and thanks for watching.